Okay, we're going to test the extensor hallucis longus. It originates on the middle anterior fib and travels all the way down here and inserts into the distal phalanx of the great toe. The patient is going to dorsiflex their great toe, and I'm going to push down 1, 2, 3, 4, 5. I'm going to compare bilaterally, same thing. 1, 2, 3, 4, 5. Relax.
This is the flexor digitorum longus. It originates on the middle posterior side of the tibia and inserts on the distal phalanges 2 through 5. The manual muscle test for this, I'm just going to place my fingers underneath the patient's toe, and then I'm going to ask her to flex them while I apply resistance. So 1, 2, 3, 4, 5. And then I'm just going to compare bilaterally. So flex them. 1, 2, 3, 4, 5.
Going to test the flexor hallucis longus. It originates in the distal 2/3 of the posterior fibula, and it inserts at the distal first toe. So you're going to have your finger underneath of the patient's great toe, ask them to curl around it, just the big toe, and then you're going to try to go up and break them. 1, 2, 3, 4, 5. Relax, and then compare bilaterally. Curl around my finger. 1, 2, 3, 4, 5. Relax. First, we are going to test the gastrocnemius. You can feel the muscle belly right here. It originates on the posterior femoral condyles, and it inserts the calcaneus via the Achilles tendon. I'm going to test this by asking the patient to go into plantar flexion, so like a gas pedal, and I'm going to resist the movement down. I want to hold up here because that's where it originates, or down here, but I don't want to be on the muscle belly. Push against me. 1, 2, 3, 4, 5. Relax, and I would compare bilaterally. So go down like a gas pedal. 1, 2, 3, 4, 5. Relax.
So the peroneus brevis involves the same main muscle test as the peroneus longus, but it inserts at the 5th metatarsal tuberosity. Okay, so we're going to test the peroneus longus. So the patient is side lying. We're going to test the uninjured side first before comparing bilaterally. So the peroneus longus originates at the lateral fibula and inserts at the base of the first metatarsal in first cuneiform. So the patient does plantar flexion and eversion, and I'm going to go against it. So I'm going to do dorsiflexion and inversion. So 1, 2, 3, 4, 5. Now I'm going to compare bilaterally. The other side. So plantar flexion, eversion. And 1, 2, 3, 4, 5.
Next, we're going to test the peroneus tertius. So it is the distal anterior fib, and as well as the interosseous membrane. That's where it originates and inserts in the base of the 5th metatarsal. So you're going to palpate right here where the muscle belly is, and then the patient is going to do dorsiflexion and eversion, and push them in the opposite. 1, 2, 3, 4, 5. Relax. Then compare bilaterally. Same thing. 1, 2, 3, 4, 5. Relax.
Okay.
We're going to test the soleus now. It originates in the posterior fibular head, and it inserts on the calcaneus via the Achilles tendon and the gastrocnemius. It is just deep to the gastrocnemius, so we want to put the knee into 90 degrees of flexion to get the gastrocnemius out of the way. We want to hold it here, stabilize, ask the patient to plantar flex. Now I'm going to resist them. 1, 2, 3, 4, 5. Relax. And then I'm going to compare bilaterally. Down like you're stepping on a gas pedal. 1, 2, 3, 4, 5. Relax.
Alright, we're gonna test the tibialis anterior. It originates at the lateral tibial condyle, and the insertion is the first cuneiform, as well as the base of the first metatarsal. You're gonna palpate the muscle belly, which is right here, and the patient is going to do dorsiflexion and inversion, and I'm gonna push them in plantar flexion and eversion. 1, 2, 3, 4, 5, relax. And I'm gonna compare bilaterally. So palpate the muscle belly, same thing, eversion, dorsiflexion. 1, 2, 3, 4, 5, relax.
Okay, so we're going to be testing the tibialis posterior. The patient is side lying, and first we're going to test the uninjured side before comparing bilaterally. So the tibialis posterior originates at the proximal tibia and fibula and inserts on all 5 of the tarsal bones. So the patient is going to do plantar flexion and inversion, and I'm going to go against it. So it's going to be dorsiflexion and eversion. So 1, 2, 3, 4, 5. And now I'm just going to compare them bilaterally. So one, 2, 3, 4, 5.